Hey everyone, welcome to Strive Physical Therapy. I'm Andrew Gibson, Doctor of Physical Therapy, coming to you live through Facebook. This is the first time we've done this, so bear with me as I kind of get to know what this whole Facebook Live thing has to offer. If you have any questions, drop them in. If you got any likes, throw them at us, some hearts, love that. Start off, if anyone has questions, does anyone know we're out there and on right now? If not, I already have a few questions that we've had asked. One, how can physical therapy help improve athletic performance or prevent future injuries? Well, physical therapy is all about getting the human body to move more efficiently, which can help an athlete. It can help, just a normal person trying to get through their daily life. So, some of the things that we have to offer with physical therapy. It's research driven, so when we're having a patient come on in, doesn't matter if you're an athlete, normal Joe out there, we're going to assess you, check out where you might have flexibility limitations, strength limitations. Some people, they have a hard time eliciting muscle contractions of certain muscle groups that are very important to their activity. So we'll kind of take a deep dive and see how that body is moving, how that performance is, and then based on our evaluation, we'll see, what we can work on. So that might be some strengthening, it might be some balance, it'll be a lot of cueing. And so for an athlete, so say they're a runner, they come in, they have knee pain. It's been bothering them for weeks, but they're still putting in 50 miles a week, but it hurts. You do the assessment, you find out, oh, your hips are weak. How can my hip be weak? I run 50 miles a week. It's just something that our human body, it finds ways to compensate, and we just need to get some localized strengthening or muscle facilitation. And so we give you a program, start with some exercises, cueing, and then over the course of time, as you get stronger, you'll start noticing that knee pain starts to decline, and you're running more pain-free. Also down here in Florida, you get a lot of golfers. So I don't know if anyone's swung a golf club. Last time I went 18 holes without practicing, my back was pretty sore. And I didn't stretch before, that was my mistake. But some people, you play multiple times a week. Our tissues, they get overused, so we gotta make sure we keep them strong, we keep it flexible. That golf swing goes really fast, right through a lot of motion. So if we're not flexible, it's gonna be pushing on a lot of muscle tightness, joint restriction, and that can lead to some pain. So we can get you some exercises, do some hands-on mobilization, soft tissue work, and get you back playing pain-free. Do you have any questions? Anyone out there? If not, I've got another question coming straight at you. So what are common misconceptions about physical therapy, and how can they be corrected? Well, this is one thing that we have to battle quite a bit, is the misconceptions. So we get some people that they come in, they want me to take their pain away that day. That's what their expectation is. I would love to, but I'm no Harry Potter, no magic wand, there's no magic pill. A lot of times people come in and it's been pain for a while. So if you got chronic pain, it's going to take a little bit of time to address any impairments or restrictions that you might have. And the biggest thing is having that two-way communication. So I need to know what your concerns are, what your goals are, and it's going to help me give you the right amount of treatment. So we're trying to find that fine line where we're trying to push you for muscle adaptation, tissue adaptations, but not push you too much to where you're super sore or more painful for more days afterwards. And that kind of goes into another misconception is, I'm going to go to physical therapy and I'm going to be in a lot of pain, or I'm going to be really sore afterwards. Well, it might be that you haven't moved very much recently. And that could be because you're in pain, which is understandable. And early on, we'll try and address, decreasing that pain over time. But it could just be movement impairments that we need to address. And, sometimes it takes a little bit of that pain and soreness for a gain for you. Let's see, any other misconceptions about therapy? Oh, that we're just all about making you pain. I mean, I'm all about having some fun in here as well. It's not just all serious business. it is a serious business, but we like to have fun doing it. And we like to have fun here at Strive, so it's enjoyable. If you're in pain or you're not feeling well, we're here for you. Our goal is to make you feel better. Our goal is not to inflict as much pain and torture, which some people think that's what PT stands for. That's not our goal. We want you to come in, we want you to feel better, get back to what you enjoy doing, love doing, and that's some of the big misconceptions. How they can be corrected, the second part of that question. They can be corrected just by education and understanding. If you go into a situation you're not comfortable in, you don't understand, usually we're a little bit more fearful. And just knowing what we had to offer, so you can call us, you can email, you can stop on into one of our 4 locations here in the Ocala, Bellevue, Williston area, and find out what we're about, meet our staff, understand that we're here for you, we want to make you feel better. And that generally allows people to kind of have a little bit better sense of what physical therapy is. Some people, they have had a hard time, that shoulder surgery, that super painful, a back issue, a knee pain, that's just really hard to get over, and they might, say, hey, physical therapy didn't work for me, they made me painful, this, that, and the other. That doesn't have to be the case for you. Come on in, check us out. Again, that communication is key. If we don't know how to help you. So we want to keep that communication in line with you. Is there any questions? I can't read this. Just some people are watching. Anyone that's watching have a question for me? Otherwise, I'm just going to keep talking. I'll give a little bit of info about our locations. So we just opened or relocated our West Marion clinic from the West Marion Hospital, HCA Hospital, off 200 here in Ocala, to another location a little bit south of there. You can find the address on our website. I don't know it offhand. We have a great staff over there. I'm the clinic director at our Mary Camp Road office location. That's obviously on Mary Camp Road in Ocala. We have a great team there. Got a few physical therapist assistants that do an excellent job. Very caring, compassionate, very fun. We got Harold, Jessica, Lucia, my assistants. Ashley's the front office coordinator. She does an excellent job. Stop in, check us out. I'm also at our Bellevue location. It's hard to miss us if you're heading towards Orlando from the Ocala area, or if you're coming up from the villages. We're right there off 441, I believe. It has a few different numbers, so I can't keep them all straight. But we're right off the road there. Stop in. Got Lori, our front office coordinator. Excellent job, very nice. Thomas, my physical therapist assistant. He does a great job too, very personable. He very compassionate, excels in that one-on-one time, giving you the best care possible. Williston, Jose is up there. He's the main physical therapist. And I believe Julie's the physical therapist assistant. Great job up there in Williston. That's a bit of a stretch if you're in the Bellevue area. But if you're in the north side of Ocala, up by Gainesville, anywhere around that Williston area, they'd be happy to have you. Sorry, I forgot the names of the West Marion Clinic. Nick is up there. Emmy. Maria is our hand therapist. She's our hand therapist for the Strive locations. Excellent, excellent hand therapist. Sarah is also with us, hand therapy. We got Becky, Dejanaya, our front office. Very sweet, very personable. So if you have any questions on any billing issues, things like that, scheduling, they're the ones to go to. Those are our 4 locations. Again, get a hold of us. Reach out if you have questions. I'm happy. I try and return emails or phone calls within that 24 hours. So if you got questions, or just stop on in, check us out. Anyone got questions? Any hands? Any hands? Hands? Hands up there. I know it's a spur of the moment, early morning. Some of you might be at work, some of you might be golfing, some of you might be at the Y, some of you might be at your fitness center. But if you do have any follow-up questions, we're going to try and make this a little bit more regular in terms of the Facebook Live, so we can tune in the future. Send us your questions and we can get them answered. You got 5 seconds for questions. 4, 3, 2, 1.5. Have a great weekend, guys.